We've got Sanjiv Badhwar, Dr. Sanjiv Badhwar, who's joining us on the other big topic that's been roiling global markets. He's the head of ENT services at Kokilaben, Dhirubhai, Ambani Hospital, here to discuss with us the coronavirus. All you really need to know about what it is, how you can take any preventative actions, and if you're a business traveler, what this possibly means for you as well. Dr. Badhwar, thanks so much for joining us today in the studio.
Morning.
So first, help us just dispel any myths around the virus. People are comparing it to SARS. People are saying it's spreading a lot faster. They're wondering how to protect themselves. First, just encapsulate for us really what it's all about.
Okay, so what is the coronavirus? So basically, the coronavirus exists in the environment. Okay. There are about 6 or 7 of them, which exists in animal. Sometimes there is human transmission, and you get a mild cough, cold, and it passes. What is new about this is that sometime in December, a worker working in a seafood cum exotic animal market was found to have pneumonia. And when he was further tested, we found a new variant, which is now called the novel coronavirus 19. So this is different because not too much is known about it. We speculate how it's going to be spread, and there's no approved treatment for it presently. But the data says that it is less infectious than, less dangerous than the SARS or the MERS virus. The fatality is 3%. That is, one infected person can infect 3 or 4 people.
But is it scary then, the fact, the pace at which it's spreading, the numbers that we are hearing? Of course, China is most badly hit, but already we're hearing cases in Kerala, for example. You say it's only 3%, but we've already got a death toll. So how scary is that?
Yeah, so that is where the public health workers come in. That is why talks like this are helpful, because one, how does it spread? So this spreads by droplet. It is not airborne. So you have to have direct contact with infected material. That is one. So it is recommended that if, suppose, someone is coughing or sneezing, there has to be a distance of at least 3 meters to be non-infectious. So that is one. So you don't have to wear masks and walk around because this is not airborne. It is transmitted by droplets.
So just to put it very simply, God forbid, if somebody has a virus in this studio, will that person can potentially infect all of us in this studio?
So, okay, coming to that moot point, unless...
Not a great example.
So basically, unless he coughs on you, unless you have direct contact with those droplets, you're not going to get infected. As things stand.
Okay. Now, it's winter time, there's pollen in the air, all of us are coughing and sneezing. How is it that you know that it's time for you to test it for any sort of virus as opposed to it just being a common cold or flu?
Yes, that is a very good question because we've already started having patients walking into our OPD saying, please test me for coronavirus. So hold on. You have to have history of recent travel to China, history of recent travel to the infected province, Wuhan, in the Hubei, area of China, or contact with somebody who has recently moved in from there. Having said that, if you have high-grade fever, we're coming to the symptoms, So basically, it may start off with a cold. It may start off with body ache, low-grade fever, sometimes moving on to extreme cold, cough, pneumonia, and finally, complications. So if you have visited China, if you have contact with somebody who's been there or traveled there, and you are exhibiting cough, cold, high-grade fever, breathlessness, then please see your doctor.
Okay. How dangerous it is, because now the virus has spread to 20 countries. You've got 3 confirmed cases in Kerala as well. If avoided or if avoidable, do you not travel to cities or countries where the virus has spread?
Okay, that's the WHO gives a travel advice. Currently, this is level 3. That means avoid non-essential travel.
Okay.
So I guess that answers the question.
So no going to Kerala if you can avoid it?
No. Kerala would be taking it too far. But as things stand, Wuhan, China, avoid non-essential travel.
Okay. What about international travel to non-Chinese provinces? Because the fear is that the Chinese have traveled all over the world. And how international travel minus China, safe?
It's absolutely safe. So coming to the question, what do you do when you travel internationally? Do you wear a mask? No. So it all comes down to good hygiene. So it is recommended for the international traveler And it's, you know, it's on the other side. If you have a cough or a cold, if you're sneezing, please cover your face with tissues. Discard the tissues immediately after use. And most importantly, don't touch your face, your eyes, or your mouth post coughing or sneezing. The use of hand rubs or sanitizers based in alcohol, extremely important. Wash your hands. Use tissues if you're coughing or sneezing. There's currently WHO has not recommended the use of masks.
Let's say you did travel. What's the incubation period? I mean, we've been hearing about quarantines and so forth before you realize that you're infected.
Yes.
And what are some of the nodal agencies for treatment?
Yeah, so basically, see, the incubation period currently, because, you know, studies are still going on in this, currently it's 10 to 14 days.
Okay.
So that is the incubation period. But what is dangerous about this virus is that you can be asymptomatic up to 10 days and still transmit the virus. So there, your travel history is important.
Okay. We know it's an unknown strand of virus, right?
Yeah.
And you just mentioned that there is no sort of researched cure for it.
Yes.
How then does it take for the virus to get out of your system? If you have caught it, what is it that you need to do?
Okay,
considering there is no,
yeah.
you know, prescribed medication for it.
So, you know, this is a time where one is proud to be Indian.
Okay.
What has happened is the mass evacuation from China is unheard of.
Yeah.
And the quarantine which is taking place currently in Delhi has not been done on such a large scale. 2 units have been set up. One 300 bedded, run by the Armed Forces Medical Service, one 600 bedded, run by the ITBP Police. And this is monitored by the Ministry of Family Health and Safdarjung Hospital. So this is unique. We have evacuated our citizens, we brought them to a safe place, they are being monitored and cared for there.
So international travelers who are coming to India, can just a thermal check at the airport, is that
Yes.
good enough to know whether you're infected or not?
Yeah, see, currently, those are the protocols. You have thermal scanners, and anyone with very high-grade fever coming from an affected province is directed to a nodal agency for a checkup.
How does one know whether globally the infection is peaking or spreading?
So that will take time. These are early days yet. And like I said, although this the fatality rate is less, but it is spreading in unknown ways. Earlier it was animals to humans. The first case of human-to-human transmission has also been reported. Coming to her question, what is the treatment? The treatment currently is supportive care. So supportive care, if you have cough, it's treated. If you have a respiratory tract infection, it's treated. If you have a difficulty in breathing, that is addressed. So it is symptomatic and supportive care, which is normally led by, for example, in our hospital, our infectious diseases specialists, our chest doctors, and the whole team would take care of that.
Okay. You know, there are a lot of myths as well going around that it's targeting people with low immunity. The fatalities are only happening in age group of 50 plus. Is there any truth to it?
See, the only issue is, as per the data which we have with us, people who are already elderly, who have underlying chest conditions, who are immune compromised, are more at threat.
Okay, I'm going to ask you a very basic question, perhaps too simple for a doctor to answer, but just for the benefit of our viewers. Saturday when I went with my family to a mall, in the picture halls I saw people were wearing masks. In cinema halls, in pubs, do you think that's not going to solve any purpose?
No, my advice on this channel would be WHO does not recommend the use of masks.
Okay, remind
No, but
us,
if you're sneezing in such a confined space, like
So
a
that's why I
movie
said,
theater, it's just nicer if you cover, right?
See, the onus is on the person. Like I said, good personal hygiene. So if you're sneezing, please cover your face. And like I said, you have to have 3 meters.
Just remind us, you know, when we had the SARS epidemic breakout, the kind of time it took and to find a treatment, to resolve the crisis period at least. We're hearing that this is a virus that doesn't really thrive in the heat of the summer. I mean, do we have to wait for the summer in order to see this phase out? I mean,
So, okay, see, the good news is the genome of the virus is known. People are already at work. A vaccine is 1 year away. Regarding therapy, we have anecdotal news of people in Thailand and the US who've been treated with certain antiviral drugs. But rest assured, the health services are working on a war footing to find a cure.
What about children? You know, well, as adults, we can take care of our personal hygiene, but our kids, perhaps they like to play in mud and dust. They are going to schools, they are using public transport, some of them are using school bus. what can we do to prevent our children?
See, again, wash hands.
Okay.
That's extremely important. And taking it further, wash your vegetables. Make sure that any live animal produce is well washed, and stay away from live wet markets.
Okay. Just to put it simple, that when you say somebody has cough and cold, do not panic on day one. If you have fever for more than 3 days, that's the time they should consult a specialist.
Yes.
Is that the pattern you should follow?
Absolutely.
Okay. Would you blame all the virus talk on social media that, that social media, that somehow, mountain has been made out of a mole?
See, Nikunj, this is the age of information. And as a health practitioner, you have to inform the community about what's going on. So yes, there is a bit of hype. That's why talks like this and what's going on with my colleagues all over are extremely important to cut down the hype. Yes, one has to be aware. Precautions are being taken. Our country is doing extremely well to take care of that. And have faith.
Assurance from a doctor coming is very crucial. So before we wrap, just one more sense and assurance from you. According to you, Indian government and the public healthcare system is geared up to tackle this thing.
Absolutely. The Indian government and the public care system is doing extremely well. And the private players like our hospital, Kokilaben, we are ready to offer support as and when called upon.
Dr. Badhwar, thank you very much. You've joined us and you've really managed to walk us through that, what coronavirus stands for, and more importantly that, we should not be worried about what's happening about this, at least in India.
Absolutely.